So the hip is something that's very near and dear to my heart. I've done a lot of extra continuing education courses for the hip. I've worked closely with orthopedic doctors. And this is something that really is passionate to me. I really hope that, at least we can get a little bit of an idea of how we can keep our hips healthy because it's incredible how important the hip joint in particular is to the entire body. So let me, and Jeff, okay, I got it. Sorry. All right. So the Healthy Hip 101. So tonight, I just pretty much want to give you a quick introduction on the hip from the inside out. You got to think of things in layers. We're going to talk about basic anatomy. I'm not going to get nitty gritty here. A couple common injuries that come just because our hips end up getting unhealthy, I'll call them. And how you want to keep your hips healthy. How can we avoid having that unhealthy hip? And then I will open up for some questions. I will do my best to answer as many questions as I can. Please understand that this is all informative, and as much as I would love to be able to help evaluate and treat everyone, sometimes it really comes down to following up with a physical therapist or following up with a physician to really dive into things. But hopefully we can get, some answers here. So what's so special about the hip? Well, healthy hips are critical. The hip is responsible for almost every movement that we do in the body. It's responsible for sitting. It's responsible for walking, standing, bending down, picking things up, climbing, going up and down stairs, going up and down ladders. Overall, our balance, which plays a huge part in our fall risk population. Hip issues can lead to a lot of functional impairments and a lot of functional limitations, disabilities, because it's so important in doing almost every action that our body needs us to do. And, it's almost a domino effect. When you start to get those limitations and those disabilities, economic issues are impacted as well. So it's super important that strong hips aid in prevention of these functional limitations. It also is going to help with low back injuries, with knee injuries. Think everything's connected throughout the body. So a little bit of anatomy that I really just want to get into is, and again, like I said, it's the basics. So the hip is the largest ball and socket joint. So when I say that, I'm saying here's your socket and here's your ball. It allows for a nice fluid motion when you're moving around. So you want to be able to move in flexion, meaning bringing your knees towards your chest or bending down. Extension when you're standing up nice and tall, kicking your legs back. Rotational components, external rotation, turning our leg out, internal, crossing our legs, bringing our legs in, as well as abduction, kicking our legs out to the side, sidestepping, things like that. Adductions, bringing your legs back to you. And then you can put it all together into what's called circumduction, which is where you're basically rolling all around, making that nice circular pattern. The hip is also the strongest joint in your body. Didn't know, fun fact for the night. And it has what's called a labrum, which is a cartilage ring that sits in that socket to help with fluid motion for the hip to move nice and you don't hear any snapping or cracking and popping, all that fun stuff. So the bony structures of the hip. So we have our pelvis, which is the big part of the hip that everybody knows. If you put the hands on the side of your hips, you feel the wings, that's your pelvis right there. Your acetabulum is the fancy word for the socket. And then your femur is made up of the femoral head, which is that ball that sits nice and comfy in the socket. It's also got a greater trochanter, which is a bony structure that comes out the side. If you try and feel the upper part of your thighs, you'll feel a little bit of a bony spot sticking out. That's your greater trochanter. That is unfortunately the misdemeanor where everybody thinks that's your hip. That is not your hip. That is just part of the hip joint. And then your femur, which is your thigh bone, which is the strongest bone in the body, leading to the strongest hip in the body. We also have the soft tissue structures. So we have our labrum that I had mentioned, which is that cartilage rib. that just sits right in between the ball and socket. It lays on the socket itself. Super important for some of the injuries we're going to talk to a little bit later. So I just wanted to bring that to your attention. And there's actually a ligament inside the hip. It's called your ligament of the head of the femur, and it sits right in between and holds things together in place. On the outside of the hip joint, before we even get to those muscles and tendons and things like that, because like I said, we're thinking in layers. We started with the bones, now moving to ligaments. There's 3 ligaments. In the front, or the anterior part of the hip, you have your iliofemoral ligament, which is in red here. And you also have your pubofemoral ligament. Ligaments in general are just named from where they're attaching, just a good fun fact to know. And then if you're looking from behind, you have your ischiofemoral ligament. And these 3 ligaments help with the stability of the hip. I am not going to go into every muscle that goes to the hip, but here's the wonderful list of all the muscles that make up the hip. And I'm just going to leave that up there for a second for everybody to look through. It's important to know when we start talking about some unhealthy hip injuries, any of these muscles can lead to a tendonitis or a tendinosis. And I know those are, some big names that people know about. So just think all of these issues, if there's any kind of a muscle imbalance going on, any one of these muscles can lead to one of those itises, one of those inflammations. So, and here's just a nice demographic to show you all the different layers of the hips. Again, I'm not going to go into these ad nauseum. This is a view if I was standing behind somebody right in the center, and it shows you just alone, there's 5 muscles that lay right up against our spine and connect to our femur bone to help with rotating, just to give you a little bit of an idea. And then if I'm looking from the front, which is this right side right here, those are some of those underlying muscles as well. Okay. All right. But my hip isn't too happy. Well, hip pain can be caused by a lot of issues. Like I mentioned, any one of those muscles can be those types of tendinitises, which is acute inflammation in those muscle tissues. If that lets go and you just, it's going to get better on its own, it can lead into a chronic condition called a tendinosis, which unfortunately, again, if left untreated, or, you just, it's going to get better 6 months later, that's where the potential for any kind of muscle tear can happen, or muscle failure. So it's important to really listen to your body. And if you're starting to feel aches and pains, pain is a sign your body's telling you something's going wrong. So like I mentioned, you can get any of those tendinitises. Arthritis is a big one. It's a natural aging process that we get, is that little bit of a bone breakdown. But arthritis in general is basically the joint is starting to lose its space. So we had our nice ball with our socket with a little space in between. As we wear down, that socket starts to lay right on that ball and starts creating friction and rubbing. And that's where you get a lot of that pain from. 25.3% of symptomatic hips are that arthritic issues. Bursitis, so bursa sacs are all over our body. They're just little fluid-filled sacs all over our body, and they help aid with the friction between the muscles rubbing on top of each other. If we get some tightness, if we start to lose flexibility, we're not moving around as much, we're not as mobile, we're going to start putting a lot of pressure on those bursa sacs, and that can get inflamed and again cause an itis, which everybody feels all those aches and pains. There's also rheumatic diseases, which this is really something where if it's genetic, rheumatoid arthritis is a big one, can be a genetic component. There's a lot of other rheumatic diseases out there. There's lupus, things like that. Those are all things you really have to follow up with a physician about, because you need blood tests done. Usually it's some kind of a medication regimen on top of it. But these can also obviously stem with some hip pain. Labral tears. So I talked about that cartilage ring a little bit. Labral tears are very prevalent, especially in that athletic population. So our runners, our gymnasts, our ballet dancers, actually, anybody that's really relying a lot on hip movement in their sport, they're going to be more prone from labral tears. And once you start to tear your labrum, muscle imbalances start. And muscle imbalances lead to, unfortunately, hip impingement. So I think you can gather what I'm saying here is there's a lot of domino effect that can happen with the hip. Muscle tears, which I talked about already, fractures, especially falls. Like I mentioned, the hip, one of the big parts of the hip is balance. So when we start to lose strength, we start to lose flexibility in our hip, we're more prone to falls. And once we, you hear all the time, I fell and I broke my hip. And that just stems other things. Avascular necrosis is basically when you're having a poor circulation to your hip, and that's actually going to cause the bone to die off. I bring that up just because that can be very prevalent in people that have hip injuries. It can be a secondary complication. And then there's also nerve injuries, sciatica. Everybody hears about the sciatic nerve. The sciatic nerve runs through muscles that are in our hip, our piriformis muscle, our external rotators. If there's entrapment in that, you're going to start to feel some sciatica. All right, so now that I talked about all the fun, scary things, how do I keep my hip healthy? This is why everybody's on the call tonight. A happy hip is a healthy hip. So there's a really good rule of thumb that everybody says, oh, if I lose some weight, I'm going to feel a lot better. Well, honestly, yes, if you think about it, for every 10 extra pounds of weight that you're carrying, you're actually putting enough pressure to equal 50 pounds of weight onto your hips and your knees. So a little bit of healthy choices, healthy lifestyle can actually really impact how your hip pain can go away. So I am not a nutritionist. I am not trying to be a nutritionist. I am going to explain some of what the research says in terms of supplementation. I always tell all of my patients, especially if you're in the South Jersey area, we have ShopRite all over the place. They have registered dietitians that are free. You can go to them. They will be more than happy to discuss different nutrition aspects with you. They'll walk around the store with you. I'm sure other grocery stores across the country offer these as well. All you have to do is call and ask them. But it's a nice little added bonus for people who are really trying to be a little more health conscious with that. Like I said, you want to eat a balanced diet. So vitamin C. Vitamin C is extremely important for the formation of collagen. Collagen is what cushion and lubricates our joint. It helps decrease that friction. Vitamin E. Vitamin E is full of anti-inflammatory properties. That's going to lower bone and joint cell damage, just help promote, that healthy cellular responses. If you want to get it naturally, you don't want to take a vitamin E supplement, think sunflower seeds, think avocado, think nuts, any kind of those anti-inflammatory foods. There's also antioxidant foods. Think your dark leafy greens, your spinach, things like that, fatty fishes, salmon, cook with extra virgin olive oil, nuts, seeds, berries. I try and explain to people, you want to think of oil for your body the same way you think of oil for a machine. It's going to help lubricate. So you do want to have some of that healthy fatty oils in your body. The antioxidants that I mentioned, they actually slow the progression of arthritis inflammation. So if you looked online, which I never tell people, oh, go to Dr. Google, but if you look online at an anti-inflammatory diet, you're going to see it's filled with a lot of bright colored berries, blueberries, strawberries, things like that. That actually can help aid with inflammation if you're somebody that's more prone to having that inflammation. I also want you guys to think of home safety. Like I talked about, we want to prevent falls, we want to prevent fractures. So think of just basic, I want to declutter my house. It's the holiday time. We have a lot of decorations out. We have a lot of things laying around. Make sure that you're not having things that are easily able to be tripped on. You don't want to have a lot of those throw rugs around unless you're putting double-sided tape under them. You want to make sure you're having night lights on all over the place, because the majority of falls actually happen in the middle of the night when people are trying to get up and go to the bathroom and you can't see, you're groggy, things are extra dark. So you always want to make sure you have some night lights on. And you want to make sure you're wearing good footwear. And we're going to talk a little bit more about footwear in another slide. On top of all the diet factors that we just talked about, exercise. I'm a physical therapist. I promote exercise. Motion is lotion. You want to make sure you're moving around. So you really want to think moderate exercise. You don't want to do anything too fast, too quick. You want to avoid overuse. This is where those wear and tears can come in and inflammation can start that can lead to those tendinitises and any of those muscles we were talking about. You want to make sure that the joint isn't the one doing all of the work. The muscles around the joint, the hips, the knees, that's really where we're going to help keep that balance and avoid that wear and tear. I want you to think, when you're going to start doing some kind of an exercise regimen, think simple exercises. Always make sure you consult a doctor or a physical therapist, or at least a personal trainer, somebody, to make sure that you're doing things right. Don't just second guess and think you're doing everything, because, one wrong movement can set you over the edge. But like I said, you want to make sure you're stabilizing the joint around you with those muscles. You want the muscles working in nice harmony with each other, because if one muscle's doing too much work and one muscle's not doing enough, that's where overuse is going to come in. My patients ask me all the time, I have hip arthritis. How can I avoid this? How can I don't want to have a hip replacement. What is therapy going to do for me? And I try to explain to them, it doesn't matter if you have arthritis. We can't reverse arthritis. Arthritis is a bone disease that unfortunately sets in. But exercise has actually been scientifically proven to slow down the progression of arthritis. And like I'm talking about here, the muscles are going to stabilize that joint and take that pressure right off that joint. And that's going to make your pain go away a lot. Strength training. I'm a creature of, I want to go out for a run. I want to get on a bike. I want to just do a bike ride. But strengthening is probably the most important thing. And we're constantly forgetting about it. But this is where those muscles are going to stay strong. You want to keep them as strong as possible, again, with that joint stability. And aquatic exercises, if you have access to a pool, the pool is such a great modality that you can use with your exercises, because it's buoyancy. It's taking pressure off of the joint itself. It's making things lighter. And the resistance of just being in the water is actually going to play such a key role in strength training. I do want you to think, when you're exercising, though, soreness is normal with exercise. Expect to be sore. That we're trying to actually make things stronger. So we have to break it down a little bit to make them stronger. But if you're having a lot of pain and it's lingering for days, or it's getting worse, this is a sign to stop. You're doing too much. You need to follow up with a health professional. My big rule of thumb that I use all the time in the clinic is, if you think of that 0 to 10 scale for pain, which everybody loves, oh, well, I don't know, I have a lot of pain. 0 is nothing, 10, I'm taking you to the emergency room. If you're working at a 4 out of 10 or less, you're doing okay. You're going to feel it a little bit. Like I said, you're going to feel some soreness. If you're pushing through a 5, a 6 out of 10, you're pushing too hard, and you definitely want to scale it back. All right. So like I said, you want to listen to your body. You don't want to push through any kind of pain, because that's going to lead to your overuse injuries. A big thing, you want to quit smoking if you're a smoker. We all hear how bad things are with smoking, but what we don't realize is that smoking can lead to bone fractures. It can lead to osteoporosis. It can also lead to that tendonitis or that bursitis. You're going to have some low back pain. It's correlated to have an effect if you have rheumatoid arthritis. So you definitely want to, think twice if you are smoking, maybe trying to cut back a little bit. Supportive shoes. I know I said we were going to talk about this. So I want you to think the head bone's connected to the shoulder bone. It's the same thing in reverse. What starts at our feet is going to go to our ankles, is going to go to our knees, is going to go to our hips and our back. So you want to make sure you have good supportive shoes. They need to have a good arch in them. They need to, if you can take a shoe and basically bend it in half, there's not enough support in that shoe. So everyday shoes, you want to make sure that you're wearing something supportive. If your shoes are not supportive, there's always the orthotic approach, which again, that's something you can talk to with a doctor, a podiatrist, a physical therapist. When you're going to add something to your shoe like that and insert, you have to remember there's a weaning schedule for good reason. What I'm saying, it starts at your foot, it goes up to your ankle, it goes up to your knee. If I'm going to put an orthotic in my shoe, it's going to stabilize me and it's going to affect my knee and my ankle and my hips. So you want to just put it in gradually. And that's the same concept. But, you always want to make sure you're addressing all of that. You want to make sure you're practicing good posture. And I know whenever somebody talks about posture, we all of a sudden sit up nice and tall. You really do want to make sure posture is key. I want to take a second to look at this picture to my right of this gentleman standing. And obviously we can tell his posture isn't that great, but we don't know why his posture is not that great. Is his posture not great because he has a shoulder problem or a neck injury? Is it that he has a leg length discrepancy where one leg is shorter than the other? And to be honest with you, the answer is he has a tight right hip muscle. So if we look at this section, you can see that his hip is kind of hiking up, kind of moving up. Because it's tight, it's actually causing his right shoulder to pull down towards his hip. So he's almost getting more of a bend on his right side versus his left, which is up nice and straight and pretty. This is how we want his right side to look. So what's happening with this guy? Okay, you have a tight right hip. So now you're going to end up having a little bit of a shoulder issue and potentially some neck pain because it's going to be pulling down. On top of all of that, because he's bent more to his right, now he's going to start having some back pains. So immediately somebody might think, oh, okay, well, if I just put a shoe lift in, he'll be good. But no, if all we addressed was that tight hip, we would fix everything else going on. I have somebody who raised their hand, and I'm going to ask Jeff to help me out here a minute because this is my first time doing something like this. Jeff, how do I answer that?
What we'd ask is if you just put your questions into the Q&A at the bottom and we'll address them at the end. That'll be the easiest way to do that.
Okay, thank you. Sorry. All right. So, all right, we talked about all these different kinds of injuries that can happen. I have hip pain. Now, what do I do? Well, I'm going to tell you, if it's bothering you, you really should follow up with a physician. You really should look into it, see what's going on. The doctor can do some diagnostic tests. They can do x-rays. They can feel around. They can do an examination on you, see what's going on. They might refer you for physical therapy. And then we would follow up even further and we would be checking your range of motion. We would be checking your strength, making sure all those muscles are working in conjunction. See where the weaknesses and the impairments are. We're going to look at your balance and your flexibility. Like I just mentioned in the previous slide, it could be as simple as one muscle's tight and it's making this whole domino effect of all these ailments. Is there swelling? Swelling is usually an indication that there's some kind of inflammation going on. Special tests, we're going to rule out, is there a muscle tear? Is there, some kind of a neural involvement going on? Those are going to help us diagnose what's going on clinically. And we're going to look at how you walk, because walking tells us a lot of what's going on, a lot of those muscle imbalances. People ask me, okay, I'm going to go to the doctor. What is the doctor going to do? He's probably going to send you for physical therapy. It's possible. In New Jersey here, we have direct access. So sometimes you can even bypass the doctor and just come right to a physical therapist and let us at least examine you and see what's going on. The doctor's probably going to offer you those non-invasive approaches. I want you to follow up with a physical therapist, or I want you to go to chiropractics or acupuncture or what may be. They may suggest injections, which is scary for some people to think of. But, on a positive note with injections, which is not something I always run for somebody to try, they have medications in them, they have steroids in them. But these injections can actually be used diagnostically. Is it truly your hip, or is it coming from your back as well? They may have to look at surgical, minimally invasive issues, arthroscopic surgeries. If there's a labral tear, maybe we need to have that labral tear addressed. And, there's always the end game of, do I need to have a hip replacement? And that's really something that we need to figure out from an x-ray. We really have to see where that joint space is lying. So these are just a couple exercises that you'll see. I put up 5 that are my personal favorite. I want you to think it's important, though, that if you have hip pain, you should be doing more than just strengthening your hip. If I haven't drilled into it enough that it's important to focus on posture and focus on balance to really help with the hip and that stability, you really want to make sure that you're addressing more than just those hip muscles themselves. Core muscles, which are your low back muscles, your pelvic floor muscles. You want to make sure you're addressing your arms because, again, like we saw on that previous slide, if you have a shoulder weakness, your hips might be trying to counteract what's going on, and you're going to lead to some hip pain. Bridging, which is this top corner one. This is my all-time favorite exercise. You can modify this and change this so many different ways. It's actually a super functional movement because this is how we move over in bed. We lift our hips up to scoot over right and left. But this general bridging exercise, if I need to get more hamstring involvement, I'm going to point my toes up while I'm doing it. If I need to get a little bit more core stability, I'm going to put my arms up in the air or maybe put some weights in my arms. If I want to get some more glute involvement, meaning your tushy muscles back here, I might add a band around my knees. The possibilities are endless with bridging. It's one of my favorite exercises. As is a plank. I think planks are fantastic. Everybody should do a plank, in my opinion. But in all seriousness, planks get your core going. It gets your upper extremities going. It gets your legs going, your foot, your ankle. It works balance because now you have to hold yourself up in that space. Same thing as you would with like this bird dog, which is an exercise right in the middle here. Again, you can make this hard, you can make this easy, you can hold it out for a certain amount of count, you can use a CLX band or ankle weights or hand weights, anything, but you're also working on that balance and that joint stability as well. And leading into balance, just balancing on one leg, but making sure you're looking at yourself in a mirror, making sure your posture is great while you're doing it. And then some clamshells. Clamshells are a hip personal favorite because if we can't get our hip abductor muscles and our hip external rotation muscles firing, our hips are going to collapse and we're going to have poor balance, and it's going to lead to many other issues. Like I said, falls, things like that. And then I also just wanted to show everyone a picture of what an actual total hip looks like so that you can see you pretty much they put a whole new joint in you. You get a nice new cup and you get a new head, and the stem goes right into the femur. Or if it's arthroscopic, where, okay, we have a labral tear and we need to go in and anchor that labrum back down, then you would just go in arthroscopically with a couple little portholes and suture that back down.